everyone. Today we are going to discuss what is intravenous immunoglobulin. So before going to the topic proper, we should know what is it. So it is an immunoglobulin derived from the plasma of paid donors, and it is used in the treatment of an array of disorders like primary and secondary immune deficiency states and a variety of autoimmune and inflammatory disorders. So as per the route of administration, it can be divided into IVIG, that is intravenous, SCIG, that is subcutaneous, IMIG, that is intramuscular. So next we are going to discuss what is the mechanism of action. So there are many mechanisms of actions, among which we are discussing few. So the first one is protection against the infection. How, like some disease conditions like where there is hypogammaglobulinemia, antibody deficiency disorders, other immune deficient states. So how they act? They act by providing passive immunity, like adequate concentration of antibodies against a broad range of pathogens they will provide. Then there are some other category means hyperimmunoglobulins. So the specificity means it provides specific passive immunity, like infantile botulism and prevention and treatment of varicella infection, prevention of hepatitis B virus infection in the condition of liver transplantation, and prevention and treatment of CMV infection. The next use is alloimmunization. What is alloimmunization? We already knew that it is alloimmunization like RHD isoimmunization, where in the setting of a pregnancy, where the mother is Rh negative woman and the fetus is Rh positive, so we can give alloimmunization by providing this IVIG. The next one is suppression of inflammatory or autoimmune processes like so this is a phagocyte which is present in spleen or liver. So there is a FC receptor. So how the IVIG can act? IVIG will interact with the blocking of the FC receptor of these phagocytic cells in the liver and spleen. Then inhibition of dendritic cell differentiation and maturation, reduction of pro-inflammatory subsets of peripheral blood and monocytes like CD14 plus, CD16 plus, and suppression of cytokine production by them. Then the other action is blockade of leukocyte adhesion molecule binding to the vascular endothelium, provision of neutralizing antibodies to the microbial toxins, effects on complement immunization. Then the uses of IVIG like immune deficiency states, both primary and secondary immune deficiency states, in conditions like inborn errors of immunity, antibody production or function, CLL, multiple myeloma, reduced immune function following HSCT, hematopoietic stem cell transplantation, states of severe protein loss. Then neuroimmunologic condition like CIDP, multifocal motor neuropathy, GBS, Guillain-Barré syndrome, myasthenia gravis. Then autoimmune inflammatory conditions like immune thrombocytopenia, AHA, autoimmune hemolytic anemia, autoimmune neutropenia, acquired von Willebrand syndrome, Kawasaki disease, MIS-C, like multisystem inflammatory disease in children, which is present now after corona. And the other one is infections and infection related disorders like chronic parvovirus infection, and the child is present anemia, and there is a decreased immunity, and measles post exposure prophylaxis. Then other alloimmune process like hemolysis of the fetus and newborn we have already discussed, post transfusion purpura, antibody mediated organ transplant ejection. So how we are going to produce it? For the production of the IVIG, it takes approximately 9 months. It is produced from the pooled human plasma from several thousands, that is more than 10,000 and less than 60,000 screened, paid and voluntary donors. So the WHO is having minimum standard for this manufacturing of IVIG, like it should be extract from a pool of at least 1,000 individual donors. It should contain as little IG as possible. It should be free from preservatives or stabilizers, and the IgG molecule should have as little biochemical modification as possible and possess opsonizing and complement fixing activities. So after giving IVIG, what we should think is what are the complications. So the most common complications: infusion site pain, erythema, fever, chills, headache, myalgia, arthralgia, and tachycardia. Less common is like aseptic meningitis, hyponatremia, hemolytic anemia, neutropenia. Rare complication anaphylaxis and AKI, but we should always suspect AKI because we have to monitor RFT and we have to monitor CBC after giving IVIG. Thank you.